there's no change. So there's clearly no disassociation between my atrium and my ventricles. So I've got a first degree AV block, right? But we're not done, right? Because we've got a 12 lead here. So now I've identified the underlying rhythm. I've got a first degree AV block. And now I want to work through my ischemia to injury to infarction. And I'm going to start off at my high lateral leads, my 1 and AVL. And here is my J point, which looks to be right in line. I don't notice any hyperacute T waves. They're not inverted. Okay, so no signs of ischemia, no signs of injury. I'm going to go over to a continuing lead, all right? And once again, my J point is right in line with my isoelectric line. My T wave doesn't appear hyperacute. It's not inverted. All right, so I've got no signs of ischemia or injury in my high lateral leads. I'll go to reciprocal views now. I'll drop down to 2-3 in AVF. Once again, my J point's right in line. They're not elevated. Now in lead 3, it appears that I possibly may have, I'm in an inverted T wave, but I've got a very, very, very large R wave, terminal R wave here, which is based upon the lack of support of the possibility of ischemia. This is probably a normal progression for this large R wave to have this inverted T wave. Not concerned about it. And then as I move into AVF, once again, I've got normal J point and no abnormalities to my T wave. So in my high lateral and my inferior view, I've got no ischemia or injury noted. I'll go over to AVR. It's very common for the T wave and AVR to be inverted, so there's no harm, no foul there. But I do have some P wave inversion, which is an abnormality, but not too concerning in relation to my ischemia injury situation. So I'm going to go over into my septal and my anterior leads, my V1, V2, V3, V4, and I've got a biphasic P wave, which is once again abnormal, but I'm not overly concerned that this is an ischemic-induced issue. And my J point and my ST segment looks to be normal, moving through my septal and my anterior leads. And then when I move into my low lateral V5 and V6, once again my J points look normal, and I've got no signs of ischemia or injury. So this is simply a sinus rhythm with a first degree AV block.